Hello, everyone. My name is Carolina Elizabeth Gonzalez. I'm a board behavior analyst, and I am coming from her ABA Behavior Analytics. So today we're going to get started and see what the fun topics are about. Hello, everyone. This is her ABA Behavior Analytics. This is Carolina Elizabeth Gonzalez, BCBA. And for today's topic, we're going to be talking about rote responding. Okay, so let's get started and see what rote responding is all about. Okay, a few objectives for today. My goal is to be able to use ABA jargon and explain what is rote responding. However, in addition to also breaking it down, right? It's wonderful that we know the jargon, but do we know how to apply it? And do we understand the concepts? These are more important in understanding jargon or just being able to repeat things, okay? Another thing we're gonna be able to do is identify different examples. What is rote responding? How does this look with our children that we work with, given any age that they are, in addition to if this is a medical necessity, okay? So let's get started. Okay, this is what the field of ABA says rote responding is. In the field of ABA, rote responding refers to the repetition of a learned response without variation, often a mechanical or unthinking manner, okay? However, let's break it down. Rote responding in simple terms is when someone gives the learner or gives the same answer reaction over and over again without really thinking or understanding the context, okay? So essentially think about rote responding as a way to memorize and repeat what you just heard. You don't have to understand it, you just need to repeat it. And I'm sure, I'm raising my hand, we've all have done this, okay? During my undergrad, for example, we were supposed to memorize things that were not even of my interest. Maybe a class or subject that I was not very enthusiastic, so my motivation was really low in understanding the concepts. So what I did was I got flashcards and I started memorizing the answers, right? So kind of just memorizing. I wasn't fully understanding. A good example of this, however, I'm good at it now, is stats. I had no idea what I was doing with stats. I just memorized and I regurgitated, okay? That is rote responding, okay? But how does that look with our kids? So let's get into it. Okay, so rote responding would look like repeating learned phrases regardless of the question. So an example of this would be learned phrases. So I want, or can I have, okay? So regardless of what is in front of them, they will always say, I want or can I have, but however, they may not be referring to the context of asking for something, but they've been learned or taught to use a full sentence, okay? Another example is a child does not seem to understand the question when it is varied. And I'm talking about just slightly variation. So an example could be, what is your name versus I switch it up. So after they answer their name, I say, what's my name? And they repeat their name again. So in that situation, they're not understanding the question. They're not slowing down, possibly not picking up the cues of the question. And they're just hearing name and just answering their name. Has anyone seen this? I know I have. Another example is little to no variation when they respond, okay? That is another example. So that could be when the child, I'm positive. So going back to little to no variation when they respond. So this could look like when your learner knows to greet, right? They've memorized that when a person walks in, they say, hello, how are you, right? But they use the same phrases every single time. And when another person comes in and maybe changes what they're saying, they will keep continuously saying the same thing. Hello, how are you? Okay. Has anyone seen this? Yeah, maybe. I have. Okay. So essentially, rote responding is a skill deficit with having meaningful communication. Okay. They're missing key elements and not just slowing down, but key elements in the question or in a sentence, and they're not answering appropriately. Okay. This could be because they're not understanding the overall concepts. Okay. So let's get to other examples. Okay. These examples, I want to see if any of you guys have seen them in your field or in your practice. So let's get to it. Okay, here's an example. The adult says, hi, how are you? The child responds appropriately by saying, my name is Brian. The adult says, oh, hi, Brian. But I asked, how are you? The child then says, my name is Brian. Okay. So he did respond by saying his name, but the question was, how are you? Okay. And notice that he did not answer that. So in that situation, the child may have just learned when this person approached him and said hello, he went ahead and said his name. Okay. Let's try another example. Okay. The child says, I want cookie. The adult says, how else can you ask? The child says, I want cookie. And the child says again, I want cookie, please, right? So they're essentially just memorizing how to request. You said that if I use my full sentence, I want cookie, you're gonna give me cookie. But when the adult asked for any variation, the child was not understanding that question, okay? So this is rote responding. Okay. Here's another question, one other scenario. The mom says, how are you feeling today? The child says, happy. Mom says, but you were crying. Are you sure you were happy? The child says, happy. Okay. In the picture, the child does look happy. So I'll give the child credit for that. However, with the context, mom said that the child was crying and asked again, how are you feeling? The child just simply restated what they said, happy, gives you an understanding that this is not a meaningful conversation. They're not understanding what the parent is asking, and this is rote responding. Okay, I know at this point we talked about rote responding, memorizing, and not having meaningful conversation, right? However, there is some occasions where rote responding is appropriate. And I'm going to get into some of the appropriateness in rote responding. But even as adults, there is some appropriate rote responding. Okay, so let's get to that. Wrong slide. All right. So rote responding in daily living skills is one of the examples that it is appropriate. Okay, so when it comes to teaching daily living skills, rote model is often the most effective method. This involves teaching children to follow specific steps, rehearse the task until they have mastered them, such as learning to tie their shoes. So if you're teaching the child to memorize something, for example, like a task analysis, which is like a step-by-step guidance on how to tie their shoes, then this will be appropriate, okay? Other daily living skills are brushing your teeth, right? So there's multiple steps to brush your teeth. There is, you grab the toothpaste, you grab the brush, and it goes in order, right? That has a beginning and end, which is appropriate to teach rote responding, and that is perfectly okay. Daily living skills could deal with morning routines, combing their hair, washing their body, washing their hands. All of this is pretty much memorized steps. So rote responding in this situation is appropriate. Okay, the next one is community safety skills. This is very similar to your daily living skills, right? When it comes to teaching community safety skills, the rote model is often the most effective method, right? This involves teaching children to follow specific steps, rehearse the task until they have mastered them, such as learning to cross the street. This is huge and important. We want to make sure that when we're teaching community safety skills or any safety skills, the child is following the steps or the safety instructions to the T. Okay, so community safety, rote responding, yes, go for it. Okay, another one is intraverbal safety personal question. This is a big one. I use it all the time. Okay, this is very similar to your daily living skills and your safety community instructions. So intraverbal safety personal question essentially is answering personal safety questions. Okay, so this will be appropriate. An example of answering personal safety questions is identifying your mother's name, your dad's name, their phone number, address, right? You want to make sure that child has memorized these different questions in case of a safety situation, unsafe situation. So if, for example, in this picture, you see a little girl on the phone while the police is in the back. Little girl could have been lost, and luckily we taught her rote responding, and she was able to call her mom. Woo, go BCBA. All right. So just to recap, if you are teaching, number one, your learner to memorize academic information. So for example, ABCs, numbers, math, these are some examples. It is good to teach through rote responding. Number two, if your learner to memorize safety information, so for example, emergency or personal questions, it's important to teach. Oh, no. Okay, so now let's recap. If you are teaching your learner, number one, your learner to memorize academic information such as ABCs, number, math, any of your sciences, right? Rote responding is a go-to. Number two, if your learner, oops, it switched on us. Your learner to memorize any safety information, emergency, personal questions, this is important to teach. Number three, your learner to memorize any daily living skills, independent skills, health, hygiene skills, for example, morning routine, showers, brushing teeth, all important to teach through rote responding. Number four, your learner to memorize imitation steps or social skills. Okay, so if it's the initial portion of your teaching procedure to teach through rote, this is good too. Just make sure that in your intervention, you have a way to phase into natural environment and generalization. All right. However, be aware, okay? Important considerations for clinicians when you identify that your child or the child that you are working with engages in rote responding. Number one is if you're teaching for the child to understand the concept, okay? And the concepts could be any commands, which means requesting. Listener responding means following instructions. Intraverbals, your back and forth communication. These all, you need the child to understand the concepts. You want the child to understand that if they use their words or if they sign or if they gesture, that this means that they're going to get access to something, okay? So we don't want the child to be engaged in rote responding with any of these forms of communication. Okay. Number 2, if the child you're working with displays rote responding such as overgeneralizing, for example, calling all edibles cookies, or there is some form of faulty stimulus control, or any discrimination issues, just make sure that you are aware to ensure to start targeting or breaking through that rote responding from the beginning. Okay. And we're going to go into more of how you teach early learners or just any learner in the beginning how to break through rote responding. Okay, what does rote responding look like? An example of a child rote responding. So here's a prime example. So the child was taught to tact, or also known as label the apple. So that could have been the whole apple or the chopped apple. But once shown the variation, so for example, we taught the child to say apple with a whole apple, but now for chopped apples, the child is no longer able to label. This is a form of rote responding. This is what it looks like when they tact in a rote responding manner. Okay. Now, let's get into, now that we have identified what is rote responding, what are the pros, what are the cons, how can it impact, is this medically necessary, right? Do we need to target rote responding with a child? I think one of the first things we need to identify is what is medically necessary, okay? So let's go with the jargon first. ABA terminology. Medically necessary refers to services or interventions that are deemed essential for the diagnosis, treatment, and rehabilitation of individuals with behavioral health disorders, primarily to improve their functioning and quality of life. Whew, that was a lot of words. Specifically, medically necessary ABA services are those that are evidence-based best practices, individualized and goal-oriented, health-related necessity, cost-effective, clinical guidelines of evidence-based. Okay. So what is it in layman's terms? What is medically necessary in layman's terms? Okay. So essentially, rote responding therapy aims to improve the child's quality of life. That's it. Okay. Apply learned skills in various settings, enhancing overall communication, social integration, independence, increasing functional abilities. All of these are considered medical necessity. Okay. So does rote responding fall under medical necessity? You're right, it does. Okay. So make sure that you guys are targeting rote responding in your practice, or even with the child that you work with. Okay, so upcoming subjects. I hope you guys all enjoyed this quick clip on rote responding. The next step we're going to be talking about is teaching procedures to rote responding and evidence-based assessments on addressing rote responding. Okay, so I'm really excited about that topic because at this point, we've only talked about what is rote responding. Okay, so stay tuned and see you guys in the next one.